Dr. Quresh will give his lecture. The thing that what happens when the table death happens, as he said just now. And lot many problems are there, social problems are there, to convince the relations is there, medical legal problems are there, and Dr. Quresh is going to explain everything on that and how to manage it. Dr. Quresh.
So I'll take you straight to a true life story which happened to me. This is based on an actual incident. This patient had multiple medical problems. You name it, he had it. Thyroid, diabetes, hypertension, heart disease, obesity, and collagen disorders. Patient had all these. He came from Indore. The eye surgeon from there called me up saying there's bilateral corneal perforations. You manage. So when the relatives came, I spent almost 1 hour with the relatives, explained the necessity of general anesthesia because I needed to try to save both eyes. I wanted to put bilateral amniotic membrane grafts. Relatives were briefed about the possibility of death on table. My anesthetist and I spent 1 hour with the relatives. There were about 4 relatives who came from Indore. And we chatted with them that is a very, very high anesthesia risk. But to try and save his eyes, otherwise he will go blind in both eyes, we have to do this surgery. The inevitable happened. Patient, luckily for me, had successful surgery, came out of anesthesia, was wheeled out of the OT on a trolley, and actually said hello to the relatives. So he said hello. Then he had a sudden cardiac arrest before he could be shifted to the room. So it happened outside my operation theatre, but before he could be shifted to his private room. So the anesthetist was present, I was present, relatives were all there when it happened. So of course we rushed him back into the OT and tried to resuscitate him. I have the cardiac monitors, I have the defib machine, all of that is in my OT. We called the ambulance to shift him to the ICU. Across the street, I have a general hospital with an ICU. But he was declared dead by the cardiologist who came with his ambulance from across the street. So what next? Relatives were initially very understanding. They said, give us the body. You've explained it to us. We understand. We took that risk. Give us the body immediately. We'll take the body back to Indore by train. Indore is in central India. I refused. I called in the police after making sure that my operation theatre notes and the anesthetist notes were complete in every way. That means minute-to-minute notes were written. The police took their own sweet time in coming, about 1¼ hours, 75 minutes, and asked me why I bothered to call them. Because when they came there, they talked to the relatives. Relatives said, we don't want anything, we just want the body, we want to take it back. So the cops said, why did you call us? Simply get a friendly family physician to certify cause of death as heart attack. Give the body to the relatives, they are sitting here for disposal. I refused because I didn't want legal trouble later. Today there were 4 relatives, tomorrow there will be 40. So the legal thing in Mumbai is to ask for 5 witnesses. They are called panchas. Pancha is 5 in local language, to be present while they talk to the relatives. So 5 witnesses were my OT staff and my ward staff were called as panchas. And they talked to the relatives. They took their own sweet time chatting with the relatives. The cops explained the further procedure. After the Panchnama is the preliminary inquiry in the presence of the 5 witnesses. They would send the body to the JJ hospital, which is the state government hospital. So we are in a municipal corporation, but there is the state government hospital where a post-mortem would be conducted, authorized by the coroner. We have a coroner system in only 4 metros in India. So the post-mortem would be conducted. It is mandatory to have a post-mortem for somebody who dies within less than 24 hours of admission to a hospital. Only then would the death certificate be issued. This would be then taken to another government office. We should issue a permission certificate for the body to be taken out of state. The cops took their time explaining and made it sound as if it was as difficult as climbing Mount Everest. Since I had a clear conscience and the relatives were cooperative, the cops were getting frustrated. They took over 2 hours. So they took 1 hour, 15 minutes to come. Then they took 2 hours to record just 2 pages of statement. Finally, they called the government hearse to take the body to the JJ hospital morgue. Now the relatives were getting tired. This death had occurred at something like 10 or 11 in the morning, and it was like 2, 3 in the afternoon, and the body was still there. Nobody had eaten any food. Everybody was getting tired. So when they took the body to the morgue, I had sent my hospital manager with the patient, with the body, and the cops and the relatives there. But the class 4 employees, the peons in the morgue, told them that there are so many bodies waiting in queue for a post-mortem. So things could get delayed by hours, maybe a day, 2 days, unless they gave him speed money under the table or a bribe to expedite the post-mortem. Though I had sent my hospital manager, they readily agreed and took out money and gave the peon all the money that they had. The post-mortem was finished now in less than an hour and the certificate was issued. The morgue attendants, having been well fed, themselves accompanied the body and the relatives to the railway station, completed whatever paperwork was required. There was no other office to go to. Got the train delayed by 10 minutes. You could be the Chief Justice of Mumbai High Court, you can't get a train delayed by 1 minute. But these guys got the train, they talked to the station master, they did whatever, they got the train delayed by 10 minutes, put the body in the luggage compartment, they gave the relatives second-class compartment tickets for the 18-hour trip home. So the lessons to be, in the meantime, I had called up the embalming people. We have good embalmers who, for Christian deaths, they embalm the body because they keep it for 2-3 days before the funeral. So I had called up the embalmer saying that this body will come, will you embalm it, will you keep it? And then I was going to arrange the body to go back by flight to Indore. But these people took it away, and then my hospital manager called me to say this had happened. So what are the take-home messages that I learned which I want to share with you? Number one is stay cool. Take the relatives into total confidence right from the beginning, not after the surgery. If patient is bad risk, tell them about it before surgery. Of course, as Dr. Deshpande says, record everything, the consent and everything, but more important is actually talk to them about it. When death occurs, don't leave the hospital under any circumstances. Because leaving the hospital is a sort of admission of guilt that you're scared or worried about what will happen. This happened to a friend of ours, a reputed eye surgeon in Mumbai, who had a hospital death. He was in no way responsible. Some residents had operated. Patient died like a patient can die of a cardiac arrest. But he left the hospital premises, leaving the resident doctors to talk to the cops. When the cops came, the cops asked him, where is the owner of the hospital? The owner was at home. The cops told him, you please come here to talk to us. He says, I'm not coming. I've talked to my lawyer. Whatever it is, you talk to the residents. So he threw the residents, down the gutter, which is something which you shouldn't do. That annoyed the cops, that annoyed the relatives. After all, they've paid fees for this hospital with a reputation, and the owner is not coming there. So what would have been a simple case like in mine escalated into a conflict. So if you're there, don't leave the hospital. If you're not there when that occurs, come to the hospital, take the buck. It's not so difficult. Important thing is to understand the law, as Dr. Deshpande has said. The BNS is now more in favor of us than the old law. So call in the cops, be proactive, call in the cops, insist on this, and insist on the post-mortem. So in page 13 and 14 of the AIOS CME series on legal aspects of ophthalmology, 27, compiled by Dr. Deshpande, doctor is not arrested, though it is a cognizable offence under section 304A, now BNS section 105 as he explained, according to the Supreme Court ruling. A death at our hands, either with consent or without consent, if the surgery is done in good faith, as you mentioned, doctor, with your police friend, earns us exemption under section 88 of IPC, which is now 25 in BNS, and 92 of IPC, which is now 29 in BNS. Do not try to bribe the cops. Do not submit, you don't need to bribe the cops. Don't submit to blackmail by relatives or pay them any money to hush up the matter. Again, that is an admission of guilt. You have explained to them it was high risk, patient died. So no blackmail. At the most, you may not charge your surgical or nursing home charges or refund them whatever you have charged for the surgery as a goodwill gesture, making it clear that this is not an admission of guilt. I was prepared to refund the money and use that money to send the patient, the body back by flight. So that's the maximum. No extra money is to be paid. So in conclusion, don't wash your hands of this situation. Stay in complete control. You will never need to spend a minute behind bars like this if you do not panic. May you never face such a situation. Thank you.
Thank you, Dr. Quresh, for giving such a nice lecture on managing a death on the table or the hospital.